An eye on frost chances as well to see if we need to bring the plants in. Jeremy, thank you. October is Breast Cancer Awareness Month. Health experts say early detection is the best way to beat this disease and really all cancers. But not everyone has insurance or can afford the screenings. The University of Kansas Health System St. Francis in Topeka wants to help. Their Cancer Center Director Paula Morris is here. I'm having a little trouble today. Director Paula Morris is here to tell us about their free cancer and health screening event, which is a very important event. We're talking Breast Cancer Awareness Month, but really this goes beyond breast cancer to a variety of health conditions and diseases.
Absolutely, yeah. We're tagging on to Breast Cancer Awareness Month, and we are doing a general cancer screening event. We partner with the Masonic Cancer Alliance through our partnership with the University of Kansas Health System, and we will have dermatology on site to do skin checks. We'll have urology on site to talk about men's prostate health. We'll do colon screenings, blood pressure checks, the opportunity for women to sign up for their annual mammogram. And then this year we are also offering a genetic cancer screening event that patients who have a family history of cancer and qualify for the testing could, while they're at the event, be screened for genetic cancers.
Why are these screenings so important?
As we all know, early detection is key. The quicker we find cancer, the sooner we can get you to treatment. We all know that cancer is easily treated in the early stages, and so better survival.
It's catching today.
Yeah, better survival, better success rate with treatments when we catch cancers in their early phases.
So walking through some of the screenings that are going to be available on Saturday. So first of all, when you walk in, what's going to happen?
Yes, no need to register in advance. It is open to anyone 18 years and older, free to the public except for the genetic screening piece of that. We will have different stations set up, just kind of moving through each station as people wish to do. Not everybody wants to do all the screenings. Some people want to do them all.
So blood pressure is easy. You put the cuff on, check the blood pressure. So skin cancer, there actually will be a bit of a screening, correct? How does that work? What happens?
Correct. We'll have dermatology on site, and so they'll actually look at the skin, do skin checks, look at that. For suspicious areas, they will refer the participant, to follow up.
And prostate cancer, what types of checkup, or is there actually going to be a screening, or are they actually going to take blood, or how are you going to handle those?
That's a great question too. So urology will be on site. Dermatology, urology will be conducted in a private setting. Give you the opportunity to speak with the resident about any concerns that you have. Some patients who qualify for having blood tests, we will draw on site, and if they need to do an exam, they'll do an exam.
What about colon cancer? That's another one, especially with younger people, that we're seeing more of an issue with.
That's a great question too. Colon cancer, we will do a paper screening on that, kind of look for symptoms, signs and symptoms, and refer on to gastroenterology if you're having any concerns for that.
The conversation about mammography, what questions might you ask people who come, and what kind of information might you provide to somebody who comes and is curious about what a breast cancer screening involves? Because you won't actually be doing a mammogram that day.
Correct. We will have a sign up for someone who is eligible, women age 40 and over, or someone who's due for their annual mammogram. Questions that we may ask at that time is definitely age, your last mammogram. If you've had a mammogram, we will have information and pamphlets from our breast center available that answer some of those common questions about what is a mammogram, what types of mammograms do we have, what if I have an irregularity that I'm concerned about, what happens then and moving forward. So we will answer those questions, talk about the difference between an annual screening, a regular screening, and a diagnostic screening.
How are you going to be able to connect people with resources? Because, you know, when you talk about, oh, we'll set up an appointment for someone at home might be thinking, well, I don't have insurance, so I'm just not even going to go because they're going to refer me to things that I can't afford.
We will provide the information to the patients, or participants, I'm sorry, I keep saying patients, and let them follow up on their own. So we don't actually make those appointments. We'll give information on providers who would follow with the patient and the recommendations there at the screening.
In the case of a mammogram, you can connect them with Race Against Breast Cancer and let them know how they can get it done for free.
Absolutely, yes. We have a very strong partnership with Race Against Breast Cancer. It's a very good resource for our community here in helping women who are either underinsured or underserved.
Absolutely.
Receive
You can see the information and the hours on the screen. 9 a.m. to noon this Saturday. This is at the St. Francis Family Medicine Clinic right there on Wanamaker Road. So 2641 Southwest Wanamaker. You don't have to go into the hospital. Just go into the clinic free. You don't need an appointment, don't need to have insurance, and so many resources are going to be available there. Paula, thank you so much for letting us know all about it. A great event.
We hope to see you out there.
You bet. Hey, we're going to talk about Christmas next. We're going to look ahead to the holiday season in downtown Topeka next.